We all have likely heard the phrase, America, the land of the free, the land of equal opportunity for all. When it comes to healthcare coverage, shouldn't all Americans have the freedom to choose and have the equal opportunity for access to affordable healthcare? According to Louisville Metro Public Health and Wellness, limited access to healthcare negatively impacts the ability of a person to reach his or her full potential and quality of life. Many factors affect access to healthcare, such as the location and operation of physicians' offices, transportation, and cultural barriers. However, the single most important factor is health insurance coverage. The Affordable Care Act, healthcare reform, and Obamacare are all names used to describe the law in which all Americans are entitled to and now have access to affordable health care. This topic has been in the forefront of political debate for many years. The Affordable Care Act is a law that was enacted by President Obama on March 23, 2010, and provides access to quality, affordable health care for all Americans. The Supreme Court issued its final decision to uphold the health care law on June 28, 2012. Prior to the Affordable Care Act becoming law, millions of Americans could not afford health insurance for various reasons. Often, small businesses could not afford to offer their employees health insurance, or a person may have lost their job, or may not have been able to hold a job due to illness or injury. This population of Americans did not qualify for Medicare or Medicaid. Therefore, they often went without health care coverage for many years. Without access to affordable health insurance, a person could not afford to see a physician on a regular basis, and their health was often neglected. Kentucky launched Connect, a state-based marketplace health benefits exchange program, on October 1, 2013. Since the launch of Connect, more than 66,000 Louisville residents have enrolled. According to the U.S. Department of Health and Human Services, the Affordable Care Act provides improved access to health care, affordability for millions of Americans, and higher quality health care coverage. The Affordable Care Act is working to make health care more accessible for families, seniors, businesses, and taxpayers. The U.S. Department of Health and Human Services reports increased access to affordable health care. As of March 31, 2015, approximately 10.2 million Americans had active enrollment and coverage through the health insurance marketplace. There's been a reduction in the uninsured. In the past 5 years, about 16.4 million uninsured Americans have obtained health insurance coverage. There has been a progress in fighting health inequity. Since 2013, there's been an increase of 2.3 million African American adults and 4.2 million Latino adults gaining health care coverage. An estimated 55 million women are now benefiting from preventive service coverage with no out-of-pocket cost. There has been expansion of Medicaid under the Affordable Care Act. 12.3 million additional individuals are enrolled in Medicaid and the Children's Health Insurance Program. There's also been a reduction of uncompensated care for hospitals. With the expansion of Medicaid and increase in health care coverage, hospitals' uncompensated care costs were reduced by an estimated $7.4 billion in 2014. Millions of Americans now with health care coverage are being educated about their health care in an effort to reduce barriers and maximize use of benefits so the patient can get the care they need to live healthier lives. The marketplace allows all Americans to have access to affordable health insurance options. Health care coverage is now affordable for millions of Americans. The average premium federal tax credit is $272 a month, which assists millions of Americans the ability to purchase health care coverage. In 2014, fewer Americans had problems paying their medical bills, medical debt, and fewer went without care because they couldn't afford it. This is the first decline and lowest level in these areas since 2005. The marketplace has grown, with insurers offering more health plans, which increases consumer choice and competition that results in lower affordable premiums. Since the Affordable Health Care Act became law, cost of health care has risen at the slowest rate in 50 years. The Affordable Care Act has improved the quality of health care because all consumers have new protections. Since 2011, there has been a decrease in patient hospital-acquired conditions such as pressure ulcers, central line infections, falls, and traumas. This improvement in patient safety has saved an estimated 50,000 lives and $12 billion. Decrease in hospital readmission rates. Hospital readmissions for Medicare patients has dropped approximately 17.5% in 2013. Providers and insurers are working together to put Medicare patients in the center of their care that creates better health outcomes as well as generating savings for the Medicare program. Higher quality coverage is being provided. Everyone's health coverage has improved because consumers have new protections in place. People can no longer be turned away from obtaining health care coverage because of pre-existing conditions or dropped because they get sick. Health insurance has to cover care like emergency room visits, prescriptions, and preventive services. The political debate on healthcare reform continues while millions of Americans wait and wonder if they will continue to have access to affordable health insurance. The Affordable Care Act was enacted into law in order to improve access, affordability, and quality in health care to all Americans, no matter what your economic status may be. Without health care coverage, millions of Americans were unable to afford regular physician visits, medically necessary medications, and preventive health care. As a nurse working for a large health insurance company, I see firsthand how lack of access to affordable health care coverage has made a negative impact on this group of patients. The Affordable Care Act provides access to quality, affordable health insurance coverage for all Americans, improving health outcomes and quality of life. The Affordable Care Act puts consumers back in charge of their health care. Under the law, the American people have improved stability and flexibility they need to make informed choices about their health.